to a hospital and or know someone that's been to a hospital, like a friend, or have you personally been to a hospital? And have you ever wondered what would happen to your loved one? Hi, my name is Marlon Gongora, and I'll be talking about how chronic disease affect us here in the U.S. First, I'll be talking about the facts about chronic diseases, just a couple of them, and how to live with these chronic diseases as well. First, let's talk about the chronic diseases. So what are we talking about for chronic diseases? It's going to be what is asthma, what is diabetes, and how do you get diabetes, and who gets Alzheimer's as well. So first, let's start with what is asthma. So first, asthma is an inflammatory disease that causes the lungs to inflame, and it also causes constriction and inflammation in the airways, which can cause coughing and soreness of the breath. So an example of that is when someone has symptoms of asthma, they have shortness of breath, they have difficulty breathing, that can lead up to dry coughing. And once they have dry coughing, it can lead up to pain and tightness in their chest. So now that I talked about asthma, let's go to how do you get diabetes? Now, one does not simply get diabetes. There are actually signs to getting diabetes. So one of the things is that they have high levels of glucose in their blood that is caused by insulin being pumped. Since the people who have diabetes, they don't exactly because their insulin is being pumped into their glucose, they're unable to use the glucose as energy, which is what causes the disease to get more advanced. So the type of diabetes that people get is type 1, type 2, and registration, the diabetes, which is for women that get pregnant. So type 2 diabetes is, as I mentioned, is when glucose is when you're eating food and the stomach tries to create glucose, and then it tries to go into the bloodstream. But the pancreas starts to create insulin, and then it creates an effect where glucose isn't able to be digested, and that essentially increases the level of glucose into your body, which makes this disease very deadly for you. Next, I'll be talking about who are the people that get Alzheimer's. Now, Alzheimer's is a disease that basically slowly starts to decay your brain. It lowers your motor skills and as well as your memory as well. Sometimes people that have Alzheimer's get confused to the point where they don't even know what they're doing, and as well as they're unable to perform simple tasks as simple as tying your shoe. So, and most of the people that get Alzheimer's are mainly the elderly, but there have been cases where people from 30 years old have gotten Alzheimer's as well. Some of the symptoms of Alzheimer's are memory loss, confusion, time, but they don't know exactly what time they're in. Some people believe that they're still young and they forget what day it is, and then they have problems solving, like how to answer a phone and stuff of that sort. Some even forget how to speak, and as well they have problems like I said, performing daily tasks, and they also have a lot of mood changes as well. So now that I talked about facts about some of the chronic diseases, let's talk about how these people live with these chronic diseases and how they can better treat themselves. So living with these chronic diseases, I'll be talking about how can you fight asthma, how can you treat diabetes, is diabetes treatable, and how to delay the effects of Alzheimer's disease as well. So first, let's talk about how you can fight asthma. So one of the ways that you can fight asthma is by avoiding the stimulation. Stimulation meaning like pollen and things that you're allergic to. There are many different things that can stimulate the asthma, which can lead to an attack. And things that you can that you can use to basically alleviate the asthma is the bronchodilators and inhalers, the steroids. As well as you can also take peak flow meters and spirometers. They're basically like things that you go to the doctor and they help you basically build the immune system. And as well as you can also take allergen shots, which they expose you to a little bit of pollen, so that way your body builds some type of immune system, so the asthma doesn't hit you as hard if you do encounter those stimulants. So this is my expert. His name is John Brotill, and he is also asthmatic, and his expertise is the respiratory. He's a respiratory therapist. So when he had asthma, he said it's so obvious. Asthma had messed me up in the head with my head. The experts at the hospital have to deal with this aspect of asthma as long with helping me obtain the ideals of asthma. They were treating asthma as though it was all in my head. Experts knew that asthma was not the cause of my anxiety. However, the chronic disease like asthma can mess with your head. So basically, what happened to him is that he had lived all his life with asthma to the point where he didn't want people to worry about him. So he hid the fact that he was in an utter pain, and he hid it from his parents, his loved ones, to the point where he almost died. And with the knowledge that he gained, he was able to control the asthma and do something become a respiratory therapist to help others, because he understands the pain that people that have asthma attacks go through. Next, I'll be talking about the diabetes and how is it treatable. So one of the things that people with diabetes can do is take insulin shots to maintain proper levels of sugar, just like seen right here. And another thing that they can do is balance their meals, so that way at least they get the right levels of sugars in their diet. And last but not least, they have to visit their doctor on a regular basis. Now, I'm going to show you a chart based on the number of people and different races that have diabetes. So over here on the y-axis is the percentage of people that have diabetes based on the x-axis, which is the races. This right here we have Alaskan and Native American, as well as Asian, blacks, Hispanics, and whites. And it's all separated by color, by men and women. So as you can see over there at the Alaskan Asians and Asians, the Alaskans come close together at around 15%, and right here on the Asians around 8 to 12% combining both of them, and over here on blacks roughly around 12 to 13%, and Hispanics come roughly around 12 to 11%, and last but not least, whites come at roughly. Now, I'm showing this graph to basically say that anyone can get diabetes. It doesn't matter what race you are, anything like that. The important thing is that you have to watch out. Make sure you check your go to a doctor so you can get so you can make sure you get diagnosed properly.
On the count of three. 1, 2, 3.